Have you tried a bunch of stuff to manage anxiety and depression, but you're still struggling? This might be why. Some strategies that work great for the short term do not help in the long run. They might make you feel better in the moment, but they do nothing to resolve your anxiety in the long run. Let me give you an example. Gwen had anxiety. She'd spent a lot of time in therapy and quite a bit of time on the internet trying to learn how to make her anxiety go away. She had learned breathing techniques. She tried grounding exercises. She talked with her therapist about stuff that made her anxious, and she tried to avoid her triggers. But her anxiety just kept coming back. Her life did not feel any more manageable now than it did before. I mean, maybe a little, but she still struggled to function in college. And when she felt anxious, she would leave class, which happened a little too often. She didn't really make friends, and she spent a lot of time alone in her room, feeling completely overwhelmed with life and not knowing where to start on her huge class load. Maybe, she told herself, I just have to cope with anxiety for the rest of my life. And this thought made her more anxious and depressed. Can you relate? A lot of articles, books, your friends, and even therapists recommend over and over that you learn coping skills to deal with anxiety. But coping skills only work in the short term. It's like you're in a small boat out in the middle of the ocean and suddenly you notice water is leaking into the boat. Anxiety is like that rising water. It feels overwhelming and threatens to sink you. Coping skills are like using a bucket to bail out the water. They're quick and effective in the moment. If you're panicking and the boat is filling fast, this bucket, these coping skills, are essential. It keeps you afloat. It prevents you from sinking. And I'm going to give you a nice list of these skills, but you cannot bail water forever. This is why most advice on the internet about anxiety fails, or it can even make things worse. Because if all you're doing is bailing water, you're going to get exhausted eventually. The most common problem for people like Gwen is that they haven't been taught how to implement the long-term skills that actually make your anxiety go down over time instead of just coping. Long-term treatments can help you get out of crisis mode and into fixing mode. Fixing a leak in the boat takes more effort and more time up front, but it addresses the root cause. So instead of endlessly bailing water, trying not to feel anxious, you're working to repair the hole so that you don't keep ending up in the same situation. So this is where cognitive treatments, therapy, or even medication come in. They help you change your relationship with anxiety or reduce its intensity over time. But here's the thing about these long-term treatments. They often don't help at all in the short term, and they sometimes even make you feel worse at first. But I'm going to teach them to you because they help you solve your problems in the long run. And after long-term treatments, there's even one more type of skills, and these are maintenance skills. They keep you healthy. They set your life up for success and low drama. And these skills keep you healthy even when you're no longer in therapy. Now, you need all three types of skills. The bucket helps you survive in the short term, but fixing a leak ensures that you won't always have to rely on that bucket. If you only bail, if you just keep relying on coping skills over and over, the leak's going to keep coming back. The anxiety is going to keep coming back. If you stop bailing and you only fix your boat, then you might sink before you get the repairs done. And if you don't do maintenance, then you're going to keep repeating that cycle of ending up in the middle of the ocean with a hole in your boat. So let's explore what these three types of skills are. Okay, short-term skills are for when you're in crisis mode. They're usually about like what might help me calm down or feel a little better or not do something stupid, right? How are you going to keep your boat from sinking? So here's a list of these. I actually I have a video on every single one of these skills. So you could just search like that skill, therapy in a nutshell, you'll find my video on it. So cognitive, there's brain dump, meditation, gratitude practice. There's gritting your teeth and getting through it, right? Some people think that suppression is a bad idea, but it actually can be an effective short-term strategy. It's just a really terrible long-term strategy. So thought suppression, avoidance skills, and distraction, like stuffing and numbing, these skills are actually valid if you're in a dangerous situation, like if you're in a war or if you're a first responder. But they can't be your only skill, right? You'll basically end up with this huge bottle of bottled up emotions if you just keep using these distraction or avoidance skills over and over again. Okay, so those are some of the cognitive skills. Somatic skills include grounding skills, which is getting present with your physical sensations, your five senses. EFT, like tapping, vagus nerve exercises, breathing, stretching, vigorous exercise, progressive muscle relaxation, hugging someone, petting an animal, washing your face in cold water. Those are all body-based coping skills. Now, let's talk about some behavioral coping skills. So this is like managing your triggers, right? Avoiding things that make you anxious or leaving a situation that stresses you out, venting, talking it through with someone, getting support like seeing a doctor or a therapist, relying on others to help regulate you. Like, oh, you have to talk to your friend because they calm you down, or you have to talk to your wife because she calms you down. And then there's medications like benzodiazepines. This is like Valium. They can help manage the anxiety symptoms in the short term, but they actually make anxiety worse in the long run. You can become dependent on them. Hospitalizations are another example of a behavioral intervention that is good in the short term. It can keep you alive. If you're suicidal, anything that keeps you alive is good because you can't get better if you're dead, right? So fast-acting medicines, suicide watch, 24/7 support, these are all good short-term treatments, but few of these actually provide any long-term treatment. So quick note about hospitalization for mental health crises. With physical emergencies, like surgery for a burst appendix, a hospitalization is going to diagnose and fix the root of the problem. But with most mental health conditions, a hospitalization is intended to just keep you stable, to help you stabilize and keep you alive. They might try to help you get an accurate diagnosis, which can be really helpful. And they're usually going to adjust your meds. They'll usually add some, and then they'll build a care plan. Sometimes there's individual and group therapy, but usually people leave the hospital feeling like, well, now what? Right? Hospitalization served its role as a short-term treatment, but not as a long-term treatment. Okay, so going back to Gwen. Gwen actually had a lot of these short-term skills. She could avoid her triggers. She could calm down in the moment, but she wasn't really doing anything to resolve her anxiety. Each of these coping skills can help your boat stop sinking, but they don't get you out of the middle of the ocean. And that's where these long-term strategies come in. So let's talk about resolving skills, these things that actually solve problems. Gwen switched up therapists, and she started seeing progress. She learned that there were two big things fueling her anxiety. The first one was worry. When we worry, our brain brings to mind the perception of danger. That triggers the fight, flight, freeze response in our bodies, and it fuels anxiety. But trying to just stop worrying doesn't work. So fortunately, her new therapist taught her the skill of scheduled worry. She retrained her brain to worry on purpose for 30 minutes a day, and that freed her from most of her anxiety and worry the other 23 and a half hours of the day. The second thing she learned was about safety behaviors. Gwen learned that anxiety is fueled by avoidance, and when we learn to stop the habit of avoiding, we can stop the habit of anxiety. But Gwen wasn't avoiding all social interactions. She would go to parties, but she would just feel anxious the whole time. So what was causing this? Her new therapist helped her explore the underlying beliefs that were keeping her scared, like, I have to be perfect or no one will like me. And her therapist helped her explore the avoidance behaviors that were fueling her anxiety. So these are safety behaviors like, oh, I need to get drunk, or I need to have a friend to go with me, or I have to make sure to talk a lot to avoid awkward silence. These are all sneaky forms of avoidance that fueled Gwen's social anxiety. So with the help of her therapist and some practice, she was able to drastically reduce her social anxiety when she replaced her safety behaviors with some new social skills and a little bit of exposure therapy. So just like Gwen, when you get out of crisis mode, you can get into learning mode. Or as I like to say, let's solve some of this crap. It's like you've made it back to shore. Now you're finding the holes in your boat and figuring out what's causing them. What is making the boards rot? Or why is the navigation making us hit rocks? So now we're starting to fix the things that are causing our boat to sink. I'm going to give you a quick list of these things. Cognitive long-term strategies are like active learning and therapy, replacing negative beliefs with more helpful ones. You're learning how to process emotions, notice them, name them, explore them, make good choices about your actions. You're becoming aware of cognitive distortions and actively replacing those negative thoughts with more helpful ones, like catastrophizing, black and white thinking, emotional reasoning, mind reading, selective focus, discounting the positive. You're going to learn about the patterns that fuel the disorder, like avoidance and worry, and you're going to learn the skills that help, like scheduled worry, journaling, gratitude, using mindful practice to retrain your brain to separate from negative thoughts and redirect your attention to what's important, or redirect your attention to the present moment. And now, instead of reacting to your big stressors or avoiding them, you sit down and you write about them. You get curious about them. You explore the patterns and you start to figure out how you can solve them. Okay, there's a few things that are like body-based or somatic-based interventions that are much more long-term interventions. They don't feel good in the short term, but in the long run, they help a lot. And that includes a healthy diet, sleep, exercise, taking the right medications and supplements, a regular practice of checking in with the nervous system and re-regulating multiple times throughout the day. And this retrains your nervous system to be parasympathetically dominant. But it's not the same as trying to force yourself to calm down. And that's where like coping skills are kind of incongruent with these long-term resolving skills. Okay, let's talk about a few behavioral changes that are better long-term strategies. This includes like learning to replace unhealthy behaviors with healthy behaviors. So for Gwen, this looks like, avoiding alcohol before parties and, creating a schedule to do her homework on time so that she doesn't feel so anxious about going to class, things like that. Setting boundaries, saying no to too many commitments, taking time for self-care, facing your fears, solving problems, building up a positive mutual support network, which includes like improving relationships, building friendships, cutting people off, group therapy. And if you're consistently seriously struggling, then medication management or more serious midterm interventions might include like a residential treatment center or an intensive outpatient program. So these are longer or midterm programs. They can go a couple weeks, couple months, even a year long. That can teach you more in-depth skills to really solve a lot of the problems going on in your life if you're experiencing a lot of serious situations. However, one of the reasons most people don't do them is they tend to be expensive. So the goal of all these longer-term treatments is to find the holes in your boat and to repair them so that your boat is solid and sturdy and it's ready to face the waves that come. Okay, now let me ask you a question. When you have a headache, do you take a painkiller? I was recently in a huge conference room where someone asked that question and about 90% of the hands went up. And then the presenter asked, but do you exercise every day and eat right? Raise your hands. And about 10% of the hands went up. Many of us are willing to do the thing that makes our pain go away in the moment, like coping skills, but it takes a little more discipline to do the daily practices that foster long-term health. And I think it's silly to think that managing thoughts and emotions is an action. It's something you can do, or it's something that your doctor can do for you instead of a life practice. If we really want to have a really healthy relationship with our life and with our emotions, we need to learn how to implement healthy habits daily, weekly, and monthly. And that's where maintenance skills come in. We are maintaining the boat, painting it regularly, removing the barnacles, making sure the maps and navigation are up to date so you don't keep hitting rocks. Now, of course, storms come in occasionally, but because your boat is sturdy, you can ride it out and get back to shore safely. So at this point, the daily crises are gone and you've gotten really good at facing your fears. That means that a lot of the dramatic anxiety has resolved in your life. You don't buy into cognitive distortions, so you don't catastrophize anymore. Your emotions are a lot more level overall. Now you're going to implement the tiny changes that make your life sustainable, purposeful, and wonderful. So I'm happy to say that Gwen has slowly and gradually built up the ability to attend all of her college classes, and her anxiety has decreased a ton. But when it does flare up, she feels really confident that she can handle it. And she also has a lot of good practices in place that help her feel healthy and strong. Oh, now let me give you some of these examples of skills that sustain and maintain mental health. So as you grow, some of these cognitive skills are like, you're going to gain confidence in your ability to resolve problems. You're shifting your core beliefs about yourself from being broken to being resilient. You have a reasonable calendar with downtime scheduled in. You take care of your body. You stick to healthy routines like sleep and exercise. You have systems to maintain your health. So for example, like once a week, you sit down and journal about how you're doing, or you're building the skills to function well at work and be productive in life. You're building communication skills and conflict resolution skills. Nobody's perfect, right? Nobody has all of this stuff figured out. But these maintenance skills are just like, I'm learning and growing every day. And you're getting clear on your life purpose and your values. And you're putting your energy toward that purpose. You're gradually building up a group of people who support you and you support them. Basically, you're getting to a place in your life where you're responsive instead of reactive. You can honestly say, I plan ahead to manage and resolve problems, but when they come up, I handle them with confidence. And instead of focusing all your energy on staying afloat, at this point, you have the ability to think about the maps and compass. Where do I want to go? Where am I taking my boat? And how will I get there? You get really clear on what you want your life to be about. You know your purpose and your actions line up with that purpose. And when storms come up, you have people who help you and you have the skills to navigate safely. Your boat's solid and ready to get to your destination. Gwen is on the other side of her anxiety issues. She's dating a super nice guy. She's almost done with her degree in speech-language pathology, and she's looking forward to working in elementary schools helping kids. She's got a supportive group of friends, and she feels pretty darn optimistic about the future because she knows she can handle what life throws at her and keep learning when things get tough. Okay, I hope this video helps you think about why you still have anxiety after trying a bunch of coping skills. If you find yourself getting stuck, make sure you're moving up from coping skills to resolving skills, and then you could move to maintenance skills. I promise it's possible to get unstuck and live a purposeful life where your problems don't sink you. Okay, if you want to learn some of these skills, check out my membership where I will walk you through each of these skills in short video lessons. There's a little workbook activity to go with each of them. You put in 15 or 20 minutes a day for a month and your life will change. Check it out, links in the description. Thank you for watching and take care. Hey, real quick, if you found any part of this video helpful, I would really appreciate it if you give it a thumbs up or share it with someone who could benefit from it today. Really appreciate it. Thank you so much and take care.